A CCMA is measuring an elderly patient's blood pressure and obtains 182/110 mmHg. What should the assistant do first? A. Document the result and move to the next patient. B. Recheck the blood pressure after 2 minutes for accuracy. C. Call the patient's pharmacy for medication adjustment. D. Ignore since elderly patients often have high readings. Answer: B. A severely high reading should be confirmed before alerting the provider. Rechecking helps rule out error from cuff size, patient movement, or anxiety. Which of the following actions breaks the chain of infection at the portal of exit? A. Hand hygiene. B. Bandaging a wound. C. Vaccination. D. Antibiotic prescription. Answer: B. Covering a wound prevents pathogens from exiting the body and spreading. This interrupts transmission at the portal of exit stage. A provider instructs a CCMA to prepare a patient for an EKG. Which action ensures accurate results? A. Having the patient cross their arms over the chest. B. Ensuring the patient is lying still and relaxed. C. Placing limb electrodes directly over bony prominences. D. Applying lotion before attaching electrodes. Answer: B. Patient movement and muscle tension cause artifacts. The patient must lie still and relaxed for accurate readings. Which vaccine should be stored in a freezer according to CDC guidelines? A. Influenza, inactivated. B. Hepatitis B. C. MMR, measles, mumps, rubella. D. DAP. Answer: C. The MMR vaccine requires freezer storage to maintain potency. Others are refrigerated. A patient is scheduled for a fasting blood glucose test but admits to drinking coffee with sugar 1 hour prior. What should the CCMA do? A. Continue with the test as scheduled. B. Reschedule the test for another day. C. Document and notify the provider before proceeding. D. Ask the patient to drink water to dilute sugar levels. Answer: C. Sugar intake invalidates fasting results. The provider must be informed before proceeding. During a routine venipuncture, the patient becomes pale and diaphoretic. What should the CCMA do first? A. Remove the tourniquet and needle. B. Call 911 immediately. C. Ask the patient to sit up straight. D. Continue and finish collection quickly. Answer: A. Signs of syncope require immediate stopping of the procedure. Removing the tourniquet and needle prevents injury. A CCMA suspects an error when entering lab results into the EMR. What is the most appropriate action? A. Delete the record completely. B. Enter the correction without explanation. C. Create an addendum and notify the provider. D. Ignore since the provider will verify. Answer: C. Medical records must not be altered. Errors are corrected with an addendum and proper notification. Which part of the medical history is most important when scheduling a patient for an MRI? A. Previous surgeries. B. Family history of diabetes. C. Presence of implanted devices. D. Childhood illnesses. Answer: C. MRI magnets can interfere with pacemakers or implants. This is the most critical history item. The patient's oral temperature reads 101.8 degrees Fahrenheit. What is the appropriate documentation? A. Febrile. B. Afebrile. C. Hypothermic. D. Normal. Answer: A. Any temperature above 100.4 degrees Fahrenheit indicates a fever and should be documented as febrile. Which method of medication administration delivers the drug most rapidly into circulation? A. Intramuscular. B. Intradermal. C. Intravenous. D. Oral. Answer: C. Intravenous administration bypasses absorption, delivering medication directly into the bloodstream. A CCMA is assigned to sterilize surgical instruments. Which method guarantees complete destruction of microorganisms? A. Autoclaving. B. Disinfection. C. Sanitization. D. Antiseptic application. Answer: A. Autoclaving uses pressurized steam to achieve sterilization, ensuring total destruction of pathogens. When instructing a patient on a Holter monitor, the CCMA should emphasize: A. Removing the electrodes before bathing. B. Exercising only lightly during the test. C. Keeping a detailed activity and symptom diary. D. Adjusting the lead wires if they loosen. Answer: C. The provider correlates heart activity with daily activities. A symptom diary is essential for accurate interpretation. What is the primary purpose of the CLIA regulations for labs? A. Protecting patients from radiation exposure. B. Ensuring accurate and reliable laboratory testing. C. Training medical assistants in phlebotomy. D. Regulating vaccine distribution. Answer: B. CLIA standards were created to guarantee accurate, reliable, and timely laboratory test results. A patient weighs 110 pounds. How many kilograms is this? A. 45 kilograms. B. 50 kilograms. C. 55 kilograms. D. 60 kilograms. Answer: B. 110 divided by 2.2 is equal to 50 kg. Medical assistants must convert weight accurately for medication dosages. Which needle gauge is most appropriate for an adult venipuncture? A. 16 gauge. B. 18 gauge. C. 21 gauge. D. 25 gauge. Answer: C. A 21 gauge needle is standard for adult venipuncture. It balances flow rate with minimal vein trauma. A CCMA must use which PPE when assisting with wound irrigation? A. Gloves only. B. Gloves and gown. C. Gloves, gown, and face shield. D. Gloves and shoe covers. Answer: C. Irrigation may splash fluids. Gloves, gown, and face shield provide adequate protection. Which of the following is an example of medical asepsis? A. Surgical draping. B. Handwashing. C. Sterile field maintenance. D. Autoclaving instruments. Answer: B. Medical asepsis means reducing pathogens, e.g., handwashing, while surgical asepsis is complete sterility. Which route of temperature measurement is most accurate? A. Oral. B. Axillary. C. Tympanic. D. Rectal. Answer: D. Rectal temperature reflects core body heat and is considered the most accurate method. A patient asks the CCMA to explain informed consent. The correct response is A. It is permission given after you understand the risks and benefits. B. It is when the provider asks you to sign without explanation. C. It is only required for minor procedures. D. It means you are forced to agree to treatment. Answer: A. Informed consent ensures the patient voluntarily agrees after understanding risks, benefits, and alternatives. Which tube is used for coagulation studies? A. Red. B. Light blue. C. Green. D. Lavender. Answer: B. Light blue tubes contain sodium citrate, which is used for coagulation tests such as PT and INR. A CCMA is educating a patient with hypertension about diet. Which advice is correct? A. Increase sodium intake. B. Limit processed foods. C. Avoid all fluids. D. Eat more fried foods. Answer: B. Processed foods are high in sodium, which worsens hypertension. Patients should limit them. During CPR, what is the correct compression to ventilation ratio for an adult single rescuer? A. 15:2. B. 30:2. C. 20:5. D. 10:1. Answer: B. According to AHA guidelines, single rescuer adult CPR requires a 30:2 compression to breath ratio. A patient reports sharp chest pain radiating to the left arm. What should the CCMA do first? A. Schedule an X-ray. B. Notify the provider immediately. C. Document and wait for provider orders. D. Offer over-the-counter pain medication. Answer, B. Chest pain radiating to the arm may indicate myocardial infarction. The provider must be alerted immediately. Which part of the SOAP note contains the provider's measurable findings? A. Subjective. B. Objective. C. Assessment. D. Plan. Answer, B. Objective findings are measurable, such as vitals and physical exam results. A patient fainted in the waiting room. What is the CCMA's priority action? A. Place patient in a supine position with legs elevated. B. Give the patient water immediately. C. Document the event only. D. Ask the patient to leave and rest at home. Answer, A. Elevating legs restores cerebral perfusion. Safety and stabilization are priorities. A CCMA is applying a 12-lead EKG. Where should V4 be placed? A. 5th intercostal space, left midclavicular line. B. 4th intercostal space, right sternal border. C. 5th intercostal space, midaxillary line. D. 4th intercostal space, left sternal border. Answer, A. V4 placement is critical for accurate readings and must be at the left midclavicular line, 5th intercostal. Which term means difficulty swallowing? A. Dyspnea. B. Dysphagia. C. Dysuria. D. Dystonia. Answer, B. Dysphagia refers to difficulty swallowing. Dyspnea is shortness of breath. Dysuria is painful urination. A CCMA notes that a patient has been prescribed both warfarin and aspirin. What should the assistant do? A. Report the potential drug interaction to the provider. B. Cancel the aspirin prescription. C. Ignore since both are common. D. Advise the patient to stop both medications. Answer, A. Both increase bleeding risk. Reporting ensures safe medication management. The correct angle for intradermal injection is A. 15 degrees. B. 45 degrees. C. 90 degrees. D. 75 degrees. Answer, A. Intradermal injections are given at a shallow 15 degrees angle into the skin surface. Which of the following urine test screens for pregnancy? A. Ketones. B. HCG. C. Protein. D. Specific gravity. Answer, B. Human chorionic gonadotropin, HCG, is the hormone detected in pregnancy tests. When performing a venipuncture, which vein is preferred? A. Basilic vein. B. Median cubital vein. C. Cephalic vein. D. Dorsal hand vein. Answer, B. The median cubital is large, stable, and least likely to cause complications. Which type of communication is most effective when explaining a procedure to a child? A. Using technical medical terms. B. Using age-appropriate language and visuals. C. Speaking in a monotone. D. Ignoring their questions. Answer, B. Age-appropriate explanations and visuals reduce anxiety and promote cooperation. Which agency regulates workplace safety for healthcare workers? A. CDC. B. OSHA. C. FDA. D. CMS. Answer, B. OSHA enforces workplace safety standards to protect healthcare staff from hazards. A CCMA documents a patient's height as 5 feet 8 inches. What is this in inches? A. 66 inches. B. 68 inches. C. 70 inches. D. 72 inches. Answer, B. 5 feet equals 60 inches. 60 plus 8 is equal to 68 inches. What does HIPAA primarily protect? A. Patient confidentiality and health information. B. Medical assistant licensing. C. Vaccine storage rules. D. Provider malpractice insurance. Answer: A. HIPAA laws safeguard patient health records and ensure confidentiality. A CCMA is asked to perform anthropometric measurements. What will be measured? A. Blood pressure and heart rate. B. Height, weight, and body circumference. C. Lung capacity and oxygen levels. D. Reflexes and balance. Answer: B. Anthropometric measurements evaluate body size and proportions, used in nutrition and growth assessments. Which abbreviation means nothing by mouth? A. BID. B. NPO. C. QID. D. PRN. Answer: B. NPO, nil per os, means the patient must not consume anything orally. What is the normal resting respiratory rate for an adult? A. 8 to 12 breaths/min. B. 12 to 20 breaths/min. C. 20 to 28 breaths/min. D. 28 to 36 breaths/min. Answer: B. The normal adult respiratory rate is 12 to 20 breaths per minute. A CCMA is preparing to administer a flu shot. Which needle length is most appropriate for an intramuscular injection in the deltoid? A. 3/8 inch. B. 5/8 inch. C. 1 inch. D. 2 inches. Answer: C. A 1-inch needle is commonly used for adult deltoid IM injections. Which of the following is a CLIA waived test a CCMA may perform? A. Blood culture. B. Gram stain. C. Urine dipstick. D. Tissue biopsy. Answer: C. Urine dipsticks are simple, low-risk tests approved for CLIA waived settings.